My name is Dr. Lindsay Keith, and I'm fellowship trained in breast oncology surgery, meaning I take care of patients with benign breast diseases as well as breast cancer. I can perform biopsies in the office that allow me to help diagnose breast cancer. I can also just review imaging for patients who have had abnormal findings on their mammograms and confirm it with an exam and follow up thereafter. I also perform surgeries for breast cancer, including sentinel lymph node biopsies, mastectomies, or lumpectomies, whichever the patient decides. A lot of people think that all patients' breast cancers are the same, so I often find that women who are diagnosed with breast cancer, as soon as they let other people know that they've been diagnosed, people come out of the woodworks wanting to tell them their stories. But every single person's cancer is completely different. Out of a single day, I can talk to 3 different patients, and all 3 of them can have totally different types of breast cancer and need different types of management. So truly it's individualized care when you're dealing with breast cancer. Many different types of surgeons can do breast surgery, but a fellowship-trained breast surgeon truly understands the whole disease process, from the imaging findings to pathology to medical oncology to obviously the surgeries that are required for breast cancer. So it's important to have somebody that truly understands the entire disease process of breast cancer and not one that can just do the surgery. The treatment of breast cancer is a team sport, and typically the surgeon acts as the quarterback of the team, but we all coordinate together for each individual patient's case, and we each have our specific roles in the process. I believe that those that treat breast cancer truly would love to be out of a job one day, meaning we found the prevention for breast cancer and that we no longer have to treat breast cancer because it doesn't happen anymore. But at this time it still occurs in about 1 in 8 women's life. So we're not there yet, but we have some work to do still. The most gratifying part of my job is truly taking care of cancer patients. I realized very early on in my general surgery training that I loved cancer patients. They're just different. They have a fight in them that trauma patients don't have, that vascular patients don't have. They want to get better and they want to listen to you. They just get it. They listen to you and they want to live, and so they fight to live. Given my love for cancer patients, I truly felt that I was called into taking care of cancer patients. Initially, I truly had an interest in melanoma and breast cancer, but ultimately decided that I really loved the disease process of breast cancer, and again, working with women patients and sometimes men with this disease process and treating potentially curable cancer if it's caught early enough. I also liked developing the lifelong relationship that you build with these breast cancer patients and following them throughout their journey. I like truly seeing them conquer their fears and the anxieties that they have when they're first diagnosed and getting to the point where they're survivors. If you have any changes in your breast, have questions, or think you might be at high risk for developing breast cancer, I'd be happy to meet you, answer those questions, and discuss anything else you might want to talk about.